Good afternoon, ladies and gentlemen. We're delighted you're with us today. Our webinar is beginning. I'm Steve Love, President, CEO of the Dallas-Fort Worth Hospital Council, and we want to thank you for taking time to be a part of our educational webinar hosted in coordination with ShiftKey, who is an associate member and one of the year-round sponsors that partners here at the DFW Hospital Council. Today's topic, building a flexible and sustainable workforce for the future. We all know this is a hot topic in today's industry, and many of you know that 60% of healthcare employees reported experiencing some form of burnout in 2024. And that underscores the urgent need for flexible workforce strategies. Today, we're going to explore how on-demand workforce solution can help fill scheduling gaps, maintain high care standards, and support your teams. We're delighted we've got two people from ShiftKey with us today. Our keynote and guest speaker is Riley Helland, who is the sales director of the Acute division at ShiftKey. Also, who is going to be monitoring Q&A, and if you need one-on-one chats or if you need some offline discussions, Ann Weisel is going to be with us, and she's the senior manager of event marketing at ShiftKey. As I mentioned earlier, ShiftKey is a year-round sponsor, partners with DFWHC in presenting webinars such as these, and we're so delighted they're with us today. Before we begin, one administrative note, please put your questions in the Q&A box, and we're going to try to answer them at the end of Riley's presentation. But your questions are very important, and we want to make sure that we get to all of them. Another thing, Chris Wilson will be sending out the PowerPoint presentation, and then tomorrow he will send out an actual recording to the people that registered for this webinar. So we're real excited, and so without further ado, it's my pleasure to turn it over to Riley.
Hey, everybody. Thank you for joining. Steve, thanks for the fantastic intro for myself and ShiftKey as a whole. I appreciate the partnership that we have, and being a part of the Hospital Council means a lot to us, being in this space. So I appreciate you guys having us on, and thank you everyone for joining as attendees as well to chat through some of the workforce challenges and how on-demand solutions can kind of work with hospitals throughout Texas, but really across the country, and be a valuable solution going forward. So we can jump right into it. We got a little presentation. We'll go through some data, some stats, some numbers. We'll chat through what that looks like, some past solutions that hospitals are keen to and have used in the past, and how an on-demand solution going forward could be a viable option in hospitals, and really to kind of add to that workforce strategic plan going forward. So we'll jump in, we'll do some stats to start, and chat through that piece of it, and then we'll get into the on-demand workforce part. So we'll talk about Texas specifically. So across Texas, hospitals today are facing unprecedented workforce strain. The RN vacancy rate is now at 16.4% across the state. So that's tens of thousands of roles that are open across the state. These aren't just numbers. Every unfilled role means a heavier burden to internal staff members that are on the floor. And we're not just seeing this on the ShiftKey side with registered nurses, RNs. We're seeing it with LVNs and CNAs, and turnover and vacancy rates on that side too, which compounds the challenge, kind of adds to it. And particularly, we're seeing that in the rural markets of Texas. So these hospitals, they're already facing these recruiting hurdles. Now they're struggling to keep up with some of the patient demand and maintain service levels, which is where kind of an on-demand solution can make sense with census fluctuations, et cetera. So that being said, the result is some of this being strained care teams, increased burnout within the hospital, and some difficult financial decisions that hospitals are having to make. So these shortages, they aren't just affecting patient care, they're impacting staff morale internally, they're impacting the administrative teams from a financial standpoint, and impacting the hospital's sustainability. So Filling these roles quickly isn't just about meeting a quota these days. It's about keeping operations stable and care standards high within the hospitals, because at the end of the day, patient care is the number one goal for us, for y'all on the hospital side, and as a community. So this is why we need to rethink how hospitals build their workforce today, build their workforce strategy, and focus on the flexibility, speed, and then the tools that hospitals can grasp onto, such as an on-demand marketplace where they didn't have access to this before, kind of a new concept within the market. And it enables them to fill these gaps before they start to disrupt operations in the hospital. So that being said, these open roles, they're not just numbers, they disrupt operations and revenue, as I spoke to. So looking at that right now, a majority of these nursing positions across Texas take 1 to 2 months to fill from a hiring standpoint. So that in that month, that means care teams can be stretched thin, managers are scrambling to cover these shifts, and patients are at risk for longer wait times in the hospital. So these blips aren't temporary. They're ongoing gaps that create ongoing disruption within the hospital, and there is a solution to where these can be worked on and covered in a more sustainable, again, on-demand way rather than getting into a contract or whatever that may be. But this challenge isn't going away anytime soon either. So statistically, by 2032, Texas is projected to face a shortage of nearly 57,000 RNs, which equates to roughly 16% of the total demand being left unfilled. For any hospital that's planning growth in this expansion or just meeting their future patient loads, this creates a massive hurdle to capacity planning and strategic growth for the hospital. So what does this mean operationally for the hospital? Starts to trickle down into ER boarding, delays elective procedures, creates longer patient stays, and creates overworked, overwhelmed, overburdened teams internally. So the inability here to hire fast enough isn't just an HR compliant issue. It's a care delivery and revenue challenge that touches every corner of hospital operations. So that being said, to solve this, hospitals need more than a traditional recruiting tactic. They need fast, flexible approaches to this workforce planning that fills these gaps quickly, keeps their teams more balanced, and supports not only their patients, but also their internal teams amid ongoing shortages. So that's where we start to see these flexible on-demand workforce models come into play and really start to make a difference at hospitals and healthcare facilities across the board, across the country, and across Texas specifically. So while these vacancies can stretch teams thin, they also hit the bottom line. So we'll look at some financials here. When we talk about what that means for hospitals from a financial strain standpoint, it always comes back to workforce. So in Texas, labor now makes up 56% of total hospital operating costs. So when we zoom out and look at that, more than half of every dollar that's being spent at a hospital is going directly to workforce. And that's not just because hospitals are growing or treating more patients. We just have seen labor costs jump significantly since 2019. So COVID obviously had an impact on that. And that's translating to an additional $18.1 billion spent annually by that 2022 number. So again, what is driving that? It's not always the volume and the growth. Some of that is the premium travel contracts that we're seeing within hospitals and the rising wage demands across the board, just generally. So for hospitals that are already operating on these super thin margins within internally, this level of cost inflation isn't sustainable. It sets the stage for why we need to think differently about workforce planning and explore some more cost stable, cost effective, flexible solutions that hospitals can tap into. So you see this chart here as labor costs continue to rise, especially with the heavy reliance on these travel contracts, hospitals need to adapt and look towards a more sustainable workforce model. So statistically, currently travel contracts and travel nursing accounts for about 40% of the total nursing labor costs in Texas hospitals. That's a big chunk and a significant share when you consider travel nurses are typically, while in some cases very necessary, they typically cost anywhere from $20 to $25 more per hour compared to a local professionals from an on-demand platform, or even when you zoom out even further on that, your internal staff. So to just kind of math we add into this, if hospitals were to shift just 25% of those travel hours into local on-demand professionals, the projected savings just from the cost of housing, travel, other administrative costs that go into that would be about $1 billion annually. So that's money that we can take, we can reinvest it into the hospital, into patient care, innovation, AI, the tech that continues to come out, and really investing that back into strengthening your core team, which is something that we value very heavily on our end. So, like I said, this isn't about eliminating travel nursing. It is a necessary feat, but it's about using it more strategically and supplementing it with a cost-effective, flexible workforce option that may cater to specific needs at a hospital. So it could be someone's out on PTO or FMLA, and there's not a necessity for a travel contract. That's when some of these on-demand platforms can be a big cost saver and really add that flexibility piece to the hospital without going into a contract. So with that, how do we capture these savings with an on-demand model and with a flexible workforce without sacrificing the care and quality that goes into this patient care? So hospitals, they don't face, obviously, as you all know this, but hospitals don't face the same demand every day. Patient volumes are going to change. They're going to rise and fall by season. They're going to rise and fall by week, hour, day, however we want to break that up. Travel contracts and agencies weren't necessarily built to flex, to kind of work with the hospital on these fluctuations, which is why a lot of times hospitals can be overstaffed some days and scrambling to fill critical gaps on others. You see hospitals, they'll flex their internal staff to make sure that that contract worker is in there because they're having to pay for that person regardless. So with an on-demand workforce platform and kind of where we're getting with these statistics, you can scale your workforce up or down dynamically based on real-time needs. So if there's a need in the ER over a holiday weekend, perfect. You can post and fill these shifts within hours on an on-demand platform such as ShiftKey. On the flip side of that, if your census fluctuates, it drops, plummets, you don't have the patients and don't have the volume for the care that's in the hospital, you can flex those off the schedule easily. So you avoid carrying these unnecessary contracts because you're not locked into these static schedules. So these solutions, really what we're trying to do is create proactive approaches rather than a reactive approach. So you can automate your shift postings, you can apply acceptance rules, you can ensure that only the most trusted pre-vetted professionals that you guys are vetting and going through an orientation on the on-demand side step in during high pressure times. So that combination of automation and control keeps operations running smoothly within the hospital without adding a bunch of administrative burden to your internal teams there as well. So the idea is really the approach isn't replacing your core team, it's strengthening it and giving you flexibility to weather peak demand, without compromising your care, blowing up your internal costs. And really it's a foundation for the next piece that we'll discuss on how to integrate this flexibility into your long-term workforce strategy and mesh it with the different strategies that you guys currently have, such as mixing it with your internal staff, mixed with some of the contracts, and then supplementing some of that with an on-demand model. So really, it's not just the hospitals that are benefiting from the flexibility. It's helping to stabilize your internal care teams and internal staff on the nursing side, but also the administrative side as well. So what we're seeing really just across the industry, and you see it on this slide, is a clear shift in what drives healthcare professionals to work and to stay in the field. We're seeing on our end that flexibility isn't necessarily just a perk anymore, it's a must. So in a recent survey that ShiftKey did, there were over 2,400 professionals that were surveyed, and 78% said that schedule flexibility was the reason that they were able to re-enter the healthcare workforce. That is a huge number, and without that control over when they work, many of these professionals said they simply wouldn't be working in the industry today. So in fact, 1 in 3 healthcare workers reported, and they told us that they couldn't build their schedule around their personal, if they couldn't build their schedule around their personal lives, they would just leave the industry altogether. So that's where some of these shortages are coming from, and it's a major wake-up call for hospitals and healthcare facilities across the state, across the country. And if we want to tap in and utilize these people, and if we want to keep these experienced nurses that have been in patient care for so long, keep them in the workforce, we have to meet them where they are. So solutions like ShiftKey and other on-demand platforms for that matter empower facilities to offer that level of flexibility without sacrificing consistency or quality of care that is coming into your hospital. So how do hospitals move from today's reactive workforce model to a more strategic, future-proof approach such as a ShiftKey? So let's back up a little bit and start with the reality that they're facing today. As we've talked about, facilities are understaffed. Nurses who often remain, they're feeling stressed, they feel undervalued within the hospital, and some feel burned out. So we're seeing this more and more. Nurses are leaving their full-time roles entirely, which is really deepening the strain on internal teams and core teams. Most are going out, they're filling these gaps with a travel contract, which plugs the hole temporarily. But they can be a financial burden. They get expensive for hospitals. They're inflexible at times, and they don't help build a sustainable workforce. To my point, they're kind of just filling those gaps and plugging a hole. To where if we add in a flexible model, it can be more cost effective, but also from a strategic standpoint, you're able to kind of customize who, when, and what are coming into the hospital. So when those unexpected demand surges hit, such as flu spikes, a holiday ER rush, whatever it may be, you have the capacity to respond quickly without overburdening your core team. So that's where these steps to success come in. So by tapping into a local pool of external nursing talent, hospitals can reduce dependence on travel agencies, travel contracts, and this not only lowers labor costs for the hospital, but it also improves your nurse satisfaction, reduces burnout by giving core teams kind of the breathing room and really the flexibility that they need as well. So they're not feeling the burden of having to pick up all the overtime shifts. They can take a Saturday and go be with their family or go to their son's soccer game or whatever it may be. By simply plugging in somebody from an on-demand platform into the schedule that you guys vet and trust. So that's an important piece of what we're doing as well. And it really gives the hospital the flexibility, again, to scale up or scale down based on your real-time demand. So you can deliver consistent, high-quality care even when that patient volume is fluctuating. So let's look at just kind of a depiction of what the future workforce plan can and should look like. So this kind of gives you an idea. And the left side is kind of how hospitals have traditionally planned their workforce. In the right side being that more strategic model designed for the future, prioritizing your internal staff. If you have an internal float pool, it prioritizes that. And again, it gets to that on-demand piece to kind of plug in and be a part of your workforce. So backing up on the left, you'll see the current workforce plan that most hospitals currently rely on. It's built around the full-time, part-time nurses. You have the internal float pools, you have overtime, and then that heavy chunk of dependence on travel nurses. And the problem with this model today is that it can be rigid, can be expensive. So the overtime can quickly burn out your core staff, and travel nurses, while sometimes necessary at times, they come with the high cost and flexible contracts, making it difficult to adjust when patient volumes are rising or falling. So on the right side is the depiction of more of a future strategic workforce plan, adding in that on-demand element that gives you the flexibility to prioritize your internal staff, but also have that flexibility and backup plan should you need to kind of plug those holes in a more efficient manner to where maybe it is a 1 week need and maybe it is around the holidays. So you're plugging in these local pre-vetted clinicians that you can bring in only when they're needed. So by doing this, you're reducing your reliance on some costly travel contracts, but also giving flexibility to scale your workforce dynamically as you need it. So to my point, travel nurses don't need to, or they don't disappear entirely, but the role shifts in this model and become secondary over on-demand solutions and a supplement to that. So this hybrid approach on the right will help hospitals control costs. They protect their full-time team from burnout, and they're ensuring consistent high-quality care even with kind of the unpredictable demand surges that you guys see. So once this model is shifted to, the benefits extend far beyond savings. So when we think about the future of workforce strategy, it's not just about filling these shifts. It's about building a system that's smarter, faster, and more sustainable for the hospital. That's why investing in an on-demand marketplace makes sense from a strategic standpoint, and really to the points we've been talking through, it makes sense from just a stability standpoint for internal staff. It gives you the access to the qualified local professional nurses who understand your community, they understand your patients. The local expertise that they have can make a difference both in care quality, team dynamics, etc. Secondly, you go in and it improves your ability to respond to the unexpected rise or fall in patient volume. So you can flex up, you can flex down without scrambling, burning out your core team, or getting locked into a contract that you would only need for a week. Third, the model is very cost effective. Travel nurses, while again necessary in some cases, they are expensive, and a local on demand model option gives you kind of that peace of mind almost. And honestly, it allows you to reduce the dependency, but also manage costs more strategically within the hospital. So you also reduce overtime pressure on internal staff. So rather than pushing your team into unsafe or costly overtime hours, you can bring in help exactly when and where you're needing it. And ultimately, this is supporting your full team internally and externally for better patient care. So when your internal teams, they go in, they feel supported, they don't feel stretched thin. You maintain the quality, the great work that they do. You reduce the burnout and turnover within the hospital, and you're ultimately building a stronger, more resilient care environment for patients and internal employees alike. So ultimately, this is how hospitals can keep growing even as workforce challenges are persisting. So to kind of wrap this up a little bit in terms of the presentation, and we'll get into some Q&A. When we talk about building for the future in healthcare and being innovative and looking forward to and building an on-demand marketplace, we're not going in and we're not solving for just a short-term workforce issue. We're going to create a foundation for long-term sustainability and growth within hospitals and health systems alike. So we talked about earlier, shifting just 25% of travel nurse hours to local on-demand professionals could save Texas hospitals $1 billion every year. That number is crazy high, and it's something that I'm passionate about in terms of working with hospitals to create that long-term sustainability and growth for them and for their patients in the community. So that number there, it represents more than just savings. It's untapped potential to reinvest in your team and your patients and your future. So it's not just a temporary fix. It's a long-term strategy for sustainable growth. And with kind of the growth and innovation coming in this industry, that on-demand model, it's within reach, and it's something that is very attainable today. And excited that I get to talk to you guys about this and give you this presentation. So with that, we will move into the Q&A section. If anyone has any questions, I haven't been in the chat, so I don't know if there were any specific, but.
Yeah, I don't think we have questions in the Q&A at this point, but please write your questions in the Q&A or either in the chat, and we'll certainly take a look at those. And if you have specific that you want to deal with, and with specific even offline after the webinar, she said she'd be delighted to talk to you. You know, Riley, what a great presentation. And I was thinking back to a long time ago when I worked in hospitals. One of the slides that really caught my eye was the one where you showed a decrease in contract labor, an increase in on-demand, and a decrease in overtime. And I think most operators would feel good about that. With that said, how do you maintain the culture of your organization when you bring in these temporary on-demand workers?
Yeah, Steve, that's a fantastic question. So when working with some of these independent professionals, obviously it's really important to listen to your internal employee feedback and prioritize their shift requests. Your internal staff is someone, obviously they come first, and the on-demand workforce professionals that are coming in to help supplement some of that They're important. They're a very important part of that wheel, but you want to prioritize your internal staff as well. So if your employees are telling you a particular worker may not be a good fit for the community, listen to the feedback there and act on it. Think of the independent professionals that are coming in as a tool to prevent employee burnout, to enable more flexibility for them so that they can actually improve your hospital's culture. You can introduce new independent professionals to your employees, treat them like one of y'all's own, and really use your preferred workers consistently from the platform to build a rapport within the hospital. Technology today, we have a lot of tools within the platform, so it makes this much easier to accomplish and kind of create that continuity of care within the hospital and build rapport with administrative teams within the hospital, but also the internal staff and internal nurses.
That makes a lot of sense. And along those same lines, this isn't culture, but within hospitals, you've got your clinical staff who do excellent work, and then you've got your human resource staff, and all of them are going to be impacted by a flexible or on-demand workforce. What is your advice on how you align your clinical teams and your administrative teams like human resources so that everyone is supportive of the on-demand solutions and the flexible workforce?
Yeah, this is a fantastic and important question, Steve, too. Thank you. Thank you for asking. So my recommendation there, and we deal with this a lot and coming in, and we work with over 100 hospitals across the country. So it's a conversation that is had when we come into these communities and hospitals and begin kind of supporting their teams. But HR and clinical leadership, they really, at the end of the day, often have the same goals: better care, less burnout, and more efficient staffing within the hospital. But they approach the problem from different angles, right? So what's worked well in the hospitals that we've partnered with is getting both teams into the room early, aligning on that, and chatting through kind of what success looked like, what a plan looks like that we can all collaborate on and work together. So an example being HR might be focused on cost savings and time to fill the shift, while nursing leaders, their main priority and what they care about most is continuity and patient safety. So a flexible workforce model, when gone in and really rolled out and implemented well, supports both. So HR gets the visibility that they want and they need. They get the control over the spend. And then the clinical teams, they get the extra coverage, the extra flexible coverage that they need without stretching their full-time staffs thin. So the key that we found to kind of making both sides see this as more of a support tool, obviously not a replacement, and starting with small wins that show value to both sides and both groups in the process.
I was thinking as you were doing your presentation of Dallas and Fort Worth and Denton and, Plano and so on and so forth, how, flexible staffing sounds pretty good. But let me ask you this. Look at it through the lens of a rural hospital, and we've got several rural hospitals that are a member of the hospital council. They have a very limited workforce. How do you advise or say that you can do on-demand staffing in a very rural setting?
Yeah, it's a great question. Rural markets is really where ShiftKey cuts its teeth. We are very strong in those markets. And to your point, rural hospitals, they're often the ones facing the steepest workforce challenges. They're limited to local talent. They have more difficulty recruiting, and obviously higher cost to bring in some of the outside help because they are in a more rural market. So that's where really an on-demand model such as a ShiftKey really thrives. So you're tapping into kind of a broader network of these pre-vetted local professionals that sometimes from surrounding counties, you can fill with these critical shifts without being locked into these expensive contracts. So you can utilize them in different manners. From if you need them for a week, fantastic. If you need them for a few weeks, fantastic. So you just build the relationship with those folks in the rural markets, and they're more than happy to kind of work with you there. And really, the main idea, it's not all about the cost savings. While a great perk of that, it's not what it's all about. The on-demand model that we're talking through really helps rural teams avoid burnout because you can flex your workforce up for the peak times and scale down when the census in those rural markets drop in. again, without overburdening and over putting too much on that internal core staff shoulders. So using preferred professionals who regularly build consistency and trust with them within those rural markets. Obviously, that's crucial for the smaller hospitals in rural communities. So to really sum it up, I think we work really well in the rural markets and building pockets of local professionals within those that are able to work at those rural hospitals.
You know, you mentioned in your presentation about sometimes the operational and even financial strain that comes in on margins of hospitals. And you pointed out salary, wages, and benefits are almost 60% of the overall operating expense that hospitals have to deal with. So, as you look at a flexible workplace model that you have already implemented, how does it align with staff engagement? Are they still engaged? Do they all feel part of the same mission? What's been your experience?
Yeah, I think within that, Steve, what often can get overlooked is flexible staffing isn't just about saving money. It's about taking the pressure off your core team. So when you're not consistently leaning on them to fill every gap, they feel more supported internally. And that goes a long way to keeping them engaged and your internal staff really engaged. And when you add on top of that local pool of professionals who show up regularly that start to feel like part of your team, they kind of build that consistency and trust builds up within the hospital and helps create a stronger culture overall. So I would say yes, flexible models can absolutely help with retention and morale. It's a smarter, just more people first way to staff at the hospital level. And you're kind of getting both sides of that spectrum of, again, supporting your internal staff and opening them up a little bit in terms of scheduling, and while also bringing in strong independent professionals that can support that team and become part of that culture as well.
So, what's your advice? So, what's been your experience? You know, sometimes, hospitals want to, essentially pilot something. So, if
Hmm.
you run into a hospital leader that says, I like this flexible staffing, but I want to do it on a small scale to kind of start out with and
Hmm.
see how it works. Have you had experience on how that worked so it didn't disrupt the existing workplace structures? Or do you have any thoughts on how you started initially and stick your toe in the water, for lack of a better term, before you really move forward?
Yeah, I think that's a great point. Starting small is kind of the best way to go, especially when implementing something that is new and a new concept to the hospital. So we've implemented it at different hospitals, and we've started in, say, med surge, or we've started in their ICU, wherever maybe there's a more critical need, or in some instances they wanted to start with a less critical need that they could fill a med surge shift that they were having twice a week, whatever it may be. So I think starting small is a fantastic way to go. You don't have to overhaul your entire workforce strategy overnight and jump straight into something like this. That's the beauty of it. That's the beauty of kind of the on-demand model, is there's not much cost associated to have access to it. You're really just when nurses come in to work those shifts, that's kind of where that cost comes in. So a lot of hospitals will begin by using an on-demand model and on-demand professionals to fill these tough to cover shifts, whether it's weekends, holidays, or if you have a last minute call out. That's another one that the on demand model is really strong with. So it's a low risk way to see how the model fits into your current system.
Riley, another question I have is
Mhm.
how hard is it for a hospital to implement this? Is there upfront cost? Do they have to have special software? Is a period of time that it would take to implement this? Or can you kind of share what are the upfront commitments that a hospital would have to make?
Yeah, see that's kind of the beauty of an on-demand workforce and ShiftKey specifically, is that initial investment, so to speak. There isn't one. We have a service agreement that's agreed upon. You agree upon a flat rate that would be charged for a nurse or a CNA to come in and work the shift, and that essentially gets you access to this on-demand model. And from there's no other cost. So we'll have some hospitals use it in a sense of a contingency kind of platform that they use when, again, needs fluctuate and they have a spike one week, or Christmas or the holidays roll around and it's something that they need in a seasonal manner, then they have access to it and it kind of can sit in their background until they need it again. And then we have hospitals that are consistent users. But as far as implementation, it's very simple. It's a same day up and running. Obviously there's some orientation that can be involved in that. But that's how you find some of the best people and professionals that are going to come in and gel well with your internal staff.
So let me ask you another question, because you've got on-demand staff, and maybe you worked this out initially when you first set it up. But as you well know, with the work you do, hospitals are very much regulated. You can't hire someone with a Medicare, well, you shouldn't hire someone that's been Medicare sanctioned, Medicaid sanctioned. They got to have proper credentials. You got to make sure their nursing license is current, et cetera, et cetera, et cetera.
Mm-hmm.
And most hospitals want to control that process, where they either do it themselves or they engage a company to do it on their behalf. How do you work that into this to make sure that the person that is flexible and staffed meets all the criteria needed to be working in the hospital?
Yeah, we have a fantastic full credentialing team that manage all of this for the independent professionals that are on the platform. So everyone that goes through, they go through the onboarding process to become an active professional on the ShiftKey platform. They're all vetted, all of their licensures updated to the platform and verified prior to them being able to see open shifts that local hospitals may have in the area that they're needing filled. So we have a team that handles all of that, and then they also will work with the hospitals if there's anything additional or any specific credentials that that hospital may need. Very flexible in that manner as well, but there's a full team behind that, and they've worked very well with our current clients.
So if the hospital wanted to do their own background screening, they could do that too, correct?
Theoretically they could, but they have access to all of the background screenings that is pre-done. So that they have in the platform and in the portal that they would log into for the platform, they could click into that background screening as an example that has been done on that professional, and they can see and access all of that.
Got it.
Yep.
Riley, you've done a great presentation. I'm still looking. I don't see any questions in the Q&A, but if anyone has any question, please go ahead and type it in. And I know Ann's been monitoring and watching. And Ann, I've asked all the questions. What's a good question maybe I overlooked that you may want to ask?
Oh, that's a great question. Put me on the spot here, Steve. I like it. That's a great question. I guess I'll turn it over to Riley, see if he has any closing thoughts, any highlights, anything he thinks that he would like to highlight that maybe he hasn't already.
Yeah, we'll turn it back over to you, Riley, and we'll let you close it out. But let me just say, on behalf of all the attendees and also on behalf of the DFW Hospital Council, what a great presentation. We thoroughly enjoyed it.
Thank you, Steve. And thank you everyone who attended. Appreciated the time and being able to chat with you guys. But my kind of closing thought and final thought is really excited to be in this space and working with hospitals. It's been over the last 2 years, we've expanded quickly into the acute space. Our company started out in the post-acute space in 2016, and we've recently gotten more into the acute space as well. So excited to continue that and continue to give hospitals and health systems an on-demand flexible solution, and be an innovative difference maker in the space in DFW, but also throughout the country. So really excited for the opportunity to speak today and really chat through options and different approaches that hospitals have at their fingertips today. And it can be an on-demand workforce solution, and it can be far other technology solutions that are out there now. So my encouragement is to find what works best and for y'all's workforce. Find a partner that you can grow and trust and evolve with over time, and someone that's flexible and kind of caters to what the hospital needs and supports your internal teams and all that good stuff. So that's what I'll leave it with. I don't have any crazy other topics. I think we hit pretty much all of that. But thank you again, Steve and Chris, DFW Hospital Council, for such a great opportunity. We're honored to be a part of it.
Well, thank you. And we're certainly pleased that you're an associate member and a year-round sponsor. This will conclude our webinar, but it was very educational. And again, Chris will send the PowerPoint out, and he also will send a recording of the webinar tomorrow. So everyone, have a great rest of the day, and thank you for participating in this webinar. Have a good day.